Hello and welcome to Rooted in Impact, a podcast from United Way, Coastal and Western Connecticut. I'm your host, Ashley Gaudiano. Last week, the Connecticut General Assembly convened for a 2-day special session to deal with some critical issues: housing, food assistance, healthcare, and other timely, sensitive topics. Today, we're going to unpack a little bit what happened in Hartford, what decisions were made, and what that means for families across Connecticut, especially when it comes to housing and food insecurity. Joining me today is my colleague, Tida Infahsaeng, our Senior Director of Advocacy and Partnerships here at United Way. Tida, thanks for joining me today.
Thanks for having me.
This is a fun one. We both, I think, like to nerd out on this stuff a little bit, but we will try and keep this high level and just give listeners a little bit of a glimpse into what a special session is and what the legislature took up. And as always, people can use our social media to ask any follow-up questions, and we'll be sure to address them that way. Sound good?
Sounds great.
All right. So to begin, for listeners who may not follow the legislative sessions generally very closely, can you explain what a special session is, why this was called, and maybe what the major priorities were going into it?
Sure. So a special session is called by the governor, and it's outside a normal legislative calendar. Back in June, we finished up the long session, which was a budget session. So this was a little bit outside of the norm. This session was triggered by federal instability and pending cuts to the federal budget, among other pressures.
Right. So just quickly, Connecticut normally operates on a, once a year legislative session. It normally runs a handful of months. So this was different for us to have a special session, right?
Yes, and we are expected to go back into what they call a normal session this coming February, which is a short session. And a short session is where we make adjustments to the budget that was approved the previous year.
Okay, so there were a handful of things I think people probably heard about or read about that were the focus of this session. A housing bill that didn't make its way out after last session. I think we'll save the housing bill for another day because we could spend a lot of time talking about that. But can you share just a little bit about what some of the other things that we saw come out of the special session were?
Sure. So there were a few agenda items that were included in the special session. One was to address the budget pressures due to federal instability or cuts that I mentioned earlier. The other was to allow UConn Health to acquire Waterbury Hospital, and then also to fix issues around courthouse law enforcement procedures, children's behavioral health, and the firefighter cancer relief funding.
So most of those things happened in some form or the other, but
Yes.
for the purposes of this conversation, one of the things that we have been talking about for the last few episodes is really the federal funding cuts. And so what did the legislature do when it came to trying to respond to the federal funding cuts?
Sure. So the legislature approved a $500 million emergency response fund. So the way they did this was they raised our budget reserves to allow for emergency spending. And so this was allocated for cuts that are anticipated for SNAP, or food stamps, WIC, which is nutrition assistance for pregnant or postpartum individuals and their babies, utility assistance, healthcare, school meals, childcare, and housing. So a whole host
Oh, whole lot of things
that we're anticipating are going to be impacted by federal decisions. As we know, and what we've been talking about in the podcast, is that the shutdown had a huge impact. It's still having an impact on people's lives. But we know that HR 1, or the One Big Beautiful Bill, as it's called, includes very deep reductions or eliminations to programs like SNAP, to healthcare benefits, and it also increases healthcare costs for thousands of people in the state of Connecticut.
Yeah, and so this was the legislature and the governor's real attempt to provide some flexibility in how Connecticut can respond quickly and efficiently to some of these cuts, given that we are not in a year-round legislative session.
Mm-hmm.
So that $500 million, I think, as people can imagine, it sounds like a lot of money, but with all of the pending cuts from the federal government and all of those different areas that it can be used for, it could go really, really quickly. Is that a fair kind of assumption there?
Yes. And as an example, with SNAP, which is what people sometimes call food stamps, the cost of those benefits is around $70 million a month a month for around 360,000 people in the state of Connecticut. So now that the shutdown has ended, people have gotten their benefits back, but with the HR 1 cuts or the One Big Beautiful Bill cuts, there's an estimate of around $11 to $15 million in lost benefits per month for people who are impacted by that. So $500 million can be taken up really quickly.
Yeah, and I think that's important to understand, right? And these cuts related to HR 1 are for the foreseeable future, right? They're not just now or just this year. And so that $500 million is truly emergency response funding for the now for the state of Connecticut. But these cuts, the numbers you just rattled off, $11 to $15 million a month. It's about 86,000 people who are not going to have access to food stamps, as an example, because of HR 1. That is indefinite or until there is a federal legislative change. And so, I think there's long-term impacts. Great that we did this here in Connecticut. Great that the state and the governor has the flexibility to provide some backstop to some of these services as funding gets cut, but it's not a long-term solution.
No, for sure. We know that people who are going to be impacted by HR 1 are going to start to feel that as soon as now. And some people will be permanently kicked out of the program, and others will see their benefits severely reduced. So this is something that we're anticipating will worsen over time. We know that the state is expected to pay more in benefits and costs to run the program moving forward. And all of these changes are really intended to remove people from the program. So we're trying to work with our partners to see how we can best mitigate some of those changes.
Yeah, and those are conversations, I think, happening locally and at the state level for sure. I would just take the opportunity to say that if you work with individuals you believe are impacted, the Department of Social Services, DSS, at the state level has a ton of good resources. They have the ability to really check and see if HR 1 is impacting you, if you will have to deal with work requirements. And so for any information and resources, I can't recommend enough that people go directly to DSS website and get your information directly from the source. I think the worst thing that can happen right in this moment is to create uncertainty because of spreading information that's not quite accurate. So I would just put a quick plug in for people, nonprofit providers, anybody who may need information to actually go on to DSS website and get your information directly from them, because they are constantly working to update and make sure that people know what's happening and how it will impact them.
Yes, they've done a great job at adding new resources and tools as they get guidance from the federal government. And Ashley's right, their website, their social media is a great resource to use for yourself or your clients or anyone in your community.
Yeah, so Tida, let's take a quick pause right there. We're going to talk about a way your support is making a real difference in our community right here at United Way of Coastal and Western Connecticut. We'll be back in just a minute.
Across our footprint, families are struggling with rising food costs and reduced SNAP benefits. But together, we can make sure every table has enough to share. Share the Table Connecticut is a community-wide movement uniting local pantries, volunteers, and donors to meet the growing need. You can help by donating groceries, hosting a drive, or donating to the Alice Fund. Every contribution fills a pantry shelf, supports a family, and strengthens the bonds that makes our community resilient. Visit UnitedWayCWC.org to see how you can take a seat at the table and help your neighbors today.
So, Tida, welcome back. I feel like the last few episodes we have talked a lot about SNAP, food stamps, food insecurity, and so I know it feels a little like we're kind of beating this relentless drum. I want to just emphasize why we continue to talk about that. And I would just add in or ask you to add into your remarks, Medicaid and SNAP-related cuts are going to have a massive impact on people and, hundreds of thousands of people. Why should everyone care about that? Why do you think it is critical that we continue to talk about this, not just in light of special session, but in kind of our everyday, day-to-day world?
Sure. I mean, I think that SNAP and WIC are some of the core tools that we've had to address and bolster up the health and well-being of our communities, of our towns, right? And so the cuts that we're anticipating are some of the largest, most unprecedented cuts we're going to see in our lifetime. And I know it's hard to think about that in the moment that we're in now, but we will see our friends and our neighbors really struggling to make ends meet in a day and age where we're already having a hard time affording basic essentials. And so people's health is going to be impacted. It's going to significantly impact the economy. We know that with programs like SNAP. SNAP is one of the most effective anti-poverty tools that we have, right? It is a proven way that we keep people from staying safe, from staying healthy, being able to live out their everyday lives, go to school, learn, do everything they need to do, right? So when people don't have food, it's a really hard time for them. And we see that food is often the first thing that people give up when they can't afford to make ends meet. And we have seen, in our footprint, even before all of this happened over the past year, over 40% of our neighbors were considered ALICE. So these are people who may not be working and really struggling to make ends meet. And that's, 2 years ago with that data. Right now, we're seeing food security or hunger hit its all-time high, right? That's 16% of adults, so someone that you likely know from school, from work, and 26% of families with kids. So these numbers are only going to increase, and I think it's important for us to be aware of this so that we are acting in a way where we're trying to do our best to mitigate some of the harm around this. I think this is something that we can't stop talking about because it impacts every single one of us.
Yeah, you've said it and rattled off some really powerful numbers there. And I would just add right on the Medicaid side, the healthcare side, when people don't have access to health coverage, right, healthcare coverage, they don't stop getting sick or ill or having a broken bone, right? And so they end up in our hospital systems.
Yes.
And we absorb and treat them no matter what. And so, the inability to access healthcare literally impacts all of us,
Yes.
right? And then on the very human side, we are headed into the holidays. We're headed into the holidays, the Thanksgiving holiday and the winter holidays. And so often the place that children who come from those 26% of households, so often where they get access to food is in the school system, right? That is very often the only place for a full breakfast and a full lunch. And so when you remove the school day from a child's day-to-day routine, you remove their ability to access food. And so it's also just thinking about that very personal level of what does it look like for a family whose child or children gain access to food because they are in school and now they are on holiday break for 10 days or 11 days or 12 days. And so what is our obligation to provide support, to help advocate for other financial relief, and to dig deep in terms of our compassion for just how hard and devastating a moment this is now and how hard and devastating it's going to become for people over the next year. So I appreciate you saying it's something we have to talk about. It's something we have to continue talking about every single day.
For sure. I think that there's a lot of maybe misunderstanding or some of the narrative that we often hear around programs like SNAP or Medicaid is that it's only for a certain type of person or a certain type of population. Well, we know, in fact, that Medicaid covers a large, significant amount of births in the state. A lot of people who use Medicaid are disabled or are 60 plus years old. So it's people who need this assistance. And the same thing goes for SNAP, right? Most of the families on SNAP have children, and there's a lot of, again, disabled or elderly folks that aren't able to work that really need this benefit to survive. So it's, again, your friends, your neighbors, your colleagues, and you may be even surprised to know that a lot of people really use these programs, and it's a necessity.
Yeah, absolutely. So I just want to leave people with something actionable or even where they can find information, how they can stay engaged. We do advocacy work year round at United Way. And so, Tida, what are, maybe one or two resources for people who want to stay engaged with this work?
Sure. I think a really easy thing that you can do right away is you can subscribe to our Alice Advocate newsletter. We put that out bi-weekly in the off years, and then once we go into session, that'll be out every week. It includes things like calls to action, so simple things that you can do to have your voice be heard on things that you care about, and also resources to learn more about different topics that are impacting families across our region. That's one thing. If you are really interested in getting more engaged, we'd be happy to even meet with you or bring you up for a session that starts in February. We are very excited and be able to host anyone who wants to come up with us. And I think, if you are someone who is like, this is not for me, I don't really know what to do with all this information, even if it was a simple thing of sharing what you learned today and telling your friend or your neighbor or your coworker, hey, I learned about SNAP, or I learned about what's going on at the state. I think the more we share the information, the more we can shift the narrative and make some change.
Absolutely. We will put the link to the Alice Advocate and how to sign up for that on the social media with this podcast episode. Tida, you are a wealth of information. Thank you so much for joining me today, helping to translate the legislative session into what it really means for families. We know deeply that policy decisions are not abstract concepts or bills that sit up in Hartford or down in Washington, but actually work that has a direct impact on whether families can afford to live, how they feed their children, whether they can take one step closer to financial security, whether they can house themselves. And so I think that's why our advocacy work is so important. It's why I'm so excited that we are committed to engaging in this work and to having you lead this work. And so thank you, everybody, for tuning in today. As always, if you have questions, feel free to drop them in the comments or send us a message on social media. Thanks for listening. We'll see you next time on Rooted in Impact. At United Way of Coastal and Western Connecticut, we work side by side with our community to address critical needs and advance equitable pathways to well-being and financial security for everyone. Rooted in Impact is a podcast that highlights how we are making a difference in our communities. Thank you so much for listening. If you want to learn more about us, visit unitedwaycwc.org. And if you're interested in being our podcast sponsor, we'd love to have you. You can find new episodes every other Tuesday wherever you get your podcasts, including Spotify and Apple Podcasts.